All you should feel is just a little bit of pressure, no pain at all, okay? If you feel anything other than pressure, let me know. So what am I feeling for on the back? ASIS. Why am I doing that? So I can wrap around her hip to get to that ASIS, okay? Most patients have a pretty prominent ASIS, but some patients don't. So we gotta be really right in the front of her hip here. I'm gonna be grasping and holding. Why? Yeah, I'm gonna stabilize right there, okay? The other thing that I wanna do is what? Palpate what is on the side? Greater trochanter. So I'm gonna have my hand nice and broad. I'm not poking, okay? We wanna have our hand nice and broad so that we can locate it right away. And then I'm gonna go at an angle from that greater trochanter, and that's gonna tell me right where to go, okay? You can't be too lateral. We got to be right above the femur head, okay? Because what are we moving? The femoral head on acetabulum, okay? So it's like this here. So I'm going to use my piece of form, okay? I'm going to lay my hand over that area of her buttock, and she's going to start to clench up, and that's just a natural response. So I'm going to just kind of massage a little bit, okay? And I'm going to put my hand here. What I'm going to do is I'm pushing directly down. Okay?
Yep.
How do you feel? It's good? Okay. All right. What range of motion should I expect to improve? Hip extension, so we can measure that afterwards. What other range of motion could this improve that we talked about? Think about rotation. External rotation. So you'll see another way of this being performed. This is how I want you to perform it, because this is how most patients are going to tolerate it. But when you're an outpatient, don't be surprised, and you can practice it this way, is placing the patient. She's got great external rotation, so she doesn't really need it. But some patients, they're way up here. We can do that seams technique, and you can actually see the foot rise, so you know you're in the right position. So external rotation and hip extension both improve with an anterior glide of the femur on the acetabulum. Make sense to everybody?
Mm-hmm.
Yeah.
Okay. So it's important, what we're going to look for in the practical is that you are locating these landmarks so know that you're in the right position and that you're safe. Okay? Now,
Question.
yes.
So for the cupping, is it on over the ASIS?
Yes, I'm grabbing right onto her ASIS and I'm holding it still. And I actually can feel it moving into my hand.
Oh, okay.
Hand placement for your other hand, gluteus medius, or
We're doing it not over we're not locating a muscle specifically, we're trying to be right over the femur. So how we do that is we need to make sure that we're palpating where that greater trochanter is, and you kind of come up at a little bit of an angle here. Okay?
perfect.
Yep. So you're pretty much right in the middle of the buttock, really over the piriformis if anything, and you're gonna feel that kind of kick on. All right, yeah, and then all of a sudden it might clench up underneath your hand, so you gotta stop and relax. You can't just tell the patient to relax because it's involuntary, okay? All right, I'm gonna have you lay on your back. Everybody good with that one?
Yeah.
All right.